The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thank you for joining us today for our webinar on California Department of Managed Care's Help Center. And before I introduce our wonderful presenter, Suzanne, I just want to tell you a little bit about Family Voices of California. I am Pip Marks. I'm the Project Director for Family Voices of California. Let me just move my slides here. So we are a statewide coalition of locally based parent-run centres, and we work really hard to ensure that children and youth with special healthcare needs receive quality healthcare. And as the state affiliate of National Family Voices, we are California's federally funded family-to-family health information centre, and we provide statewide support and resources to families of children with special needs. Our webinars serve as statewide trainings on various child health related topics, and they're geared towards very diverse groups of families, professionals, advocates, parent-to-parent resource staff. Now, if you have any technical difficulties while you're attending this webinar, you can just call GoToWebinar directly on the number on the screen that you see. And due to feedback issues, we have everybody on mute from our end. Throughout the webinar, please feel free to type in any questions that you might have in the little question box on the right-hand side of your menu. Suzanne will also be opening it up for questions throughout the webinar, and we'll take questions after her presentation is done. So today's presentation is being recorded and will be posted on our Family Voices of California website, probably by the end of the day or by tomorrow. And afterwards, you're going to be receiving a very short evaluation email. We like to survey everybody to find out how you found the webinar, and we really do appreciate this information, and we thank you for your time giving us your feedback. So I'm very happy to present Susanne Tyrrhenian to you, and I just want to tell you a little bit about all the amazing work that she's done and continues to do. Suzanne currently serves as the Assistant Chief Counsel for the California Department of Managed Care's Help Center, where she manages a team of attorneys who assist consumers with healthcare issues and work to ensure that health plans are accountable to enrollees for providing timely access to required healthcare services and appropriately addressing enrollee complaints. Suzanne joined the department in 2012 and served as a senior attorney at the Help Center for 2 years before her promotion to Assistant Chief Counsel. Before joining the department, Suzanne was in private practice specializing in civil litigation. She earned her Juris Doctorate from the University of Santa Clara and graduated from the University of California, Davis, receiving a Bachelor of Arts degree in history. So, Suzanne, I'm passing the presenter role over to you. Thank you so much for doing this for us.
Thank you, Pip, for your very kind introduction and for this opportunity. And good afternoon to everyone listening in. Thank you for spending your noon hour with me. It's my pleasure and privilege to be able to speak to you about the California Department of Managed Healthcare, or DMHC, or the department, as I will sometimes refer to it in this presentation, and its Consumer Health Center, where I work. So here's our agenda for our discussions today. So I'm going to start by giving a broad overview of the DMHC, and then I'll turn my focus to our Consumer Health Center. I'll touch briefly on some of the department's priority projects or initiatives from 2018 that continue into this year that you might find of interest. And then I'll conclude with a little bit about our community engagement initiatives. Rather than hold questions until the end, I'll pause after each subject so you can ask any questions that you may have. So let's get started. In response to the unprecedented change that the Affordable Care Act brought to California's healthcare industry, the DMHC completed a strategic planning process to guide the department over a 5-year period beginning in 2015. This process resulted in the DMHC's mission statement. The California Department of Managed Healthcare protects consumer healthcare rights and ensures a stable, healthcare delivery system. And here at the Health Center, it's the protecting consumer healthcare rights that we do best. So when I came to the department, I had no idea what it was about. I have a feeling many of you on the line don't know what it's about. So the DMHC began operations in 2000 following a period of rapid expansion of the delegated model of care in California and a series of healthcare market reforms that were signed into law, all with the intent of protecting consumers. At the end of 2017, there were 75 full-service health plans licensed by the DMHC to provide healthcare services to more than 26 million Californians. The DMHC licenses and regulates the full scope of managed care models, including all health maintenance organizations, HMOs for short, in the state, as well as most preferred provider organizations, or PPOs, and exclusive provider organizations, or EPOs, and point of service plans, or PSOs. We also license and regulate Medi-Cal managed care plans in the non-COES counties. And some of the plans we license and regulate are Kaiser, Blue Shield of California, LA Care, and Inland Empire. We also oversee specialized health plans like Delta Dental, Vision Service Plans, VSP, behavioral health plans like Optum, and pharmacy plans. So the DMHC, as I said, is responsible for protecting the healthcare rights of more than 26 million consumers. Of that figure, approximately 2.5 million of these lives are Medicare Advantage enrollees who the department's health center can't assist directly. That would be the federal government's Centers for Medicare and Medicaid Services, or CMS. But we do review Medicare Advantage plans for financial solvency. So this chart shows enrollment under the DMHC. Yes? I'm sorry, somebody's laughing? Okay, maybe not. All right, I'm going to continue. This chart shows how DMHC's enrollment continues to grow and shift from predominantly commercial enrollment to a more even distribution between commercial and government enrollees due to the Affordable Care Act's expansion of the Medi-Cal population, so that now we have about 13.2 million commercial enrollees under that we oversee, and approximately 13.1 million government enrollees. So California has a unique healthcare regulatory system. The DMHC and the California Department of Insurance both license and regulate health plans in the state. The DMHC, however, has a 90% or 96% market share, whereas the Department of Insurance has 4%. And as I mentioned, we license Medicare plans with most of our authority focused on ensuring the financial solvency of those plans. And the federal government, through the Department of Labor, regulates a self-insured and administrative service-only plan. So if someone files a complaint, which I'll be talking about momentarily with the health center, and it turns out we don't have jurisdiction or authority over that individual's health coverage, that it's with the Department of Insurance or the Department of Labor, we would then forward that complaint on to those entities for further handling and let the consumer know that we had done so in writing. There was somebody who asked about DentaCal. We do license and regulate Access Dental, Health Nets of California, and Liberty Dental of California. These are the three prepaid plans that dental managed care enrollees in LA County are enrolled in. Excuse me, and they're also the three geographic managed care plans that dental managed care individuals in Sacramento County are enrolled in. So this slide shows the DMHC's key functions. At the heart of our department is its health center, which is a free service to all Californians who have issues with their health plans that we license and regulate. We have an Office of Plan Licensing that reviews health plan documents and operations to make sure the plans are complying with state law. An example of a document that our Office of Plan Licensing would review would be the health plan contracts that the health plans are required to file with us, also known as evidence of coverage. The DMHC has a team of attorneys in our Office of Plan Monitoring who regularly go out to the health plans and conduct medical surveys or audits of their operation, including their grievance system, their utilization management process, and language access, just to name a few of the things they look for when they go to survey a particular plan. We have an Office of Financial Review that conducts regular financial exams to ensure plans are financially solvent, to ensure enrollees have access to services. Also significantly, our Office of Financial Review reviews rates for individual and small group markets. So while we don't have authority to deny premium rate increases, we have saved through our rate review process California consumers over $226 million by working with the plans to get them to voluntarily lower their rates. And we're often asked, does the DMHC have any teeth or hammer when health plans don't follow the law? And the answer is yes. So here at the health center, when we investigate complaints we receive from enrollees, we're looking to see if the plan was acting in compliance or out of compliance with the law. When we do find a violation, we then send that matter over to our Office of Enforcement, which can do further investigation and take administrative law action or fine health plans when they violate the law. And some of you may recall that our department issued a $4 million fine against Kaiser a few years back for problems that enrollees had come to us with in accessing mental health care services. So somebody had asked, who'd signed up for the webinar, asked about what happens when multiple complaints are submitted to the department about the same issue over several months. The answer is we would characterize that as a systemic problem, and we track those types of systemic problems. Some current examples would be where we're finding consumers having timely access to care issues with a particular health plan, or a provider is continuing to balance bill consumers. What we would do with those, we track them for the period of months, and then we would, again, batch them in a referral over to our Office of Enforcement, who would then conduct further investigation and take action, hopefully, against these repeat offenders. So any questions about the DMHC before I turn to the Consumer Health Center?
I'm not seeing any. Yeah, no questions have come in yet, Suzanne.
Should I pause a little bit more?
No, I think it's good to keep moving forward.
Okay. And I just wanted to tell the audience, my colleague, Erin Sullivan-Pico, who is my fellow Assistant Chief Counsel, just walked in. She's here to assist me to make sure I cover everything and answer any questions that I might be unable to. So turning to the DMHC's Consumer Health Center. So the health center has about 140 employees, and they're dedicated to educating consumers about their health care rights, providing direct assistance through our contact center or call center, our clinical staff. We have a staff of 5 registered nurses who are available to answer urgent nurse issues and also online. And we here at the Help Center, we help consumers navigate and understand their health plan coverage. We want to make sure people have timely access to appropriate health care, and most importantly, we work to resolve their complaints involving their health plans. And all of our services are fast, absolutely free, and confidential. And in this time, it's important to note that we do not collect any information regarding immigration status. And I would add self-servingly that I feel our services here are effective. So to the right of this slide are the 2017 statistics about the Health Center. In April of this year, the DMHC will publish its 2018 annual report, and that will be available on our website. The address is at the bottom of this slide and every slide in this presentation. And we'll have updated Help Center by the numbers for 2018 in that annual report. So what should you do if you or a parent or a family you work with is having a problem with their health plan? Well, the first step is to file a grievance or complaint with that health plan at the toll-free number listed on the health plan ID card that everyone should be issued. Plans also must take grievances and complaints by mail and on their website. And the plan is legally required to work to resolve that issue and is required to do so within 30 days. And if it's been more than 30 days since the grievance or complaint was filed without resolution, or if the plan does resolve the resolution or does resolve the grievance or complaint within 30 days, but the individual is not satisfied with that resolution, they can come to the Health Center for assistance. I might add, as noted in this slide, however, that if the individual has an imminent or serious threat to their health, they can come to the department without going first to their health plan and seek assistance from us. And it's our nurses review complaints where people are asserting that there's an imminent and serious threat to their health to determine if that is in fact the case clinically. So if it is, those cases are fast-tracked. So one important process that consumers can take advantage of through our Help Center is the Independent Medical Review, or IMR, process. And enrollees can apply for an IMR if a health plan denies a covered benefit because they have determined the service isn't medically necessary or it's experimental or investigational. And an example of this is, for example, if I went to a doctor either within my health plan network or outside of my plan network and was told I needed a knee surgery, that doctor would have to seek authorization from the plan for that service. And if the plan medical director says it's not medically necessary for you, Suzanne, then I would have a right to come to the department to challenge that denial. IMRs can also overturn plan modifications or delays of service, treatment, or medication. An example of a delay using my knee surgery example would be if the plan, instead of telling me flat out, Suzanne, you don't need that knee surgery, it's not medically necessary, they would say something like, well, we're not sure if it's medically necessary, so we're going to give you a consultation with another orthopedic doctor to determine whether that doctor thinks it's medically necessary. And in that scenario, I could come directly to the department for an IMR to challenge that process. So an independent medical review is a decision made by doctors not affiliated with the health plan The department contracts with an outside vendor who then places the issue with a doctor who's appropriately qualified to review the matter. So in my knee surgery example, it would be a orthopedic surgeon, again, who has no affiliation with the health plan. And as part of our IMR process, we review again to see if the matter is urgent in nature, and if it is, we will have our clinical staff review the matter to determine if it qualifies for expedited review. We also reach out to the health plan to make sure we have all the medical documents relevant to the case so that the IMR doctor can appropriately review the matter. And once the IMR is decided, if it's decided in the enrollee's favor, the health plan must provide the requested service or treatment. So one thing I want to note for Medi-Cal managed care enrollees, they can go through the DMHC's IMR process as long as they haven't gone through the California Department of Social Services state fair hearing process on their issue. So if they've already done it through the state fair hearing, we cannot proceed to IMR. If they go to our IMR process and they're not successful, so the plan's decision is upheld by the IMR reviewer and they haven't gone through state fair hearing, they can go through the state fair hearing process after an unsuccessful IMR. So Medi-Cal enrollees get 2 bites of the apple, so to speak. Again, as long as they haven't gone through the state fair hearing process first. So here's an example of a case that one of the attorneys here at the Help Center qualified for independent medical review. It was a mother who filed a complaint on behalf of her 2.5-year-old son who had autism and severe behavioral outbursts. And they were requesting 30 days of coverage for intensive outpatient program services, or IOP, that their health plan had denied as not medically necessary. And it went to IMR, and the reviewer determined that the IOP services were medically necessary for 30 to 60 days for the enrollee's condition, as well as because peer review literature, which the reviewers can rely on in making their determinations, demonstrated the benefit of early intervention in children with autism. So issues that don't qualify for IMR are reviewed as standard complaints, and some common standard complaint issues are listed here. By far, the one we see quite a bit of is cancellation of coverage for asserted non-payment of premiums, billing issues. People come and complain that they are not being reimbursed at the correct rate. Quality of service issues, people complaining about the customer service they receive from the health plan when they call to submit a grievance, for example, and finding a in-network primary care doctor or other type of specialist.
Actually,
so now I'm going to.
Suzanne, there was a question about language access. Can I ask that now, just since it was somewhat covered on the last slide?
Well, I do have a language access slide down the road.
Great. Then it can wait. That's perfect. We can wait.
Rest assured, I will be covering that.
Okay.
All right. So I'm going to next go through a series of pie chart slides. The one you're looking at now shows that most of the complaints that the Health Center resolved in 2017 were, as I said, about termination or cancellation of enrollments. Also claims and financial concerns and benefit issues and coverage issues were right up there. One thing that's troubling to us is that access to care represents only a small number of complaints, and I think that continues to be the case, although every time I'm with groups, I hear about access to care problems. So what that suggests to us is that either people aren't completely comprehending what their rights are when it comes to access to care, or they simply don't know where and how to get help. And that's why speaking to groups like you folks is so important to us. And this pie chart shows a review of complaints by coverage type. Again, in 2017, most of the complaints the Help Center received were from enrollees with employer-sponsored insurance or individual and family plans, and only about less than 12% came from enrollees in Medi-Cal managed care plans. And this is despite the fact that approximately 41% of those 26 million lives in the plans the DMHC license and regulates are managed care plans. And finally, this chart shows a review of IMRs by coverage type. Again, it was the employer-sponsored insurance and individual and family plans that comprised the IMRs resolved in 2017, whereas less than 15% were for Medi-Cal managed care enrollees. All right, Pip, here's the language slide. So the DMHC Help Center provides assistance. Oops, what's going on? What happened there? Little technical difficulty here. All right. Here we are. All right. The Help Center provides assistance in many languages. In fact, we have Bilingual Contact Center representatives and other staff. And again, all of our services are free. And notably, while Latinos are the largest ethnic group in California with 15.2 million people, or approximately 39% of Californians identifying as Latino, only about 8% of all consumers who filed complaints with the Help Center in 2017 self-identified as Latino. Limited English proficiency contacts at the Help Center made up less than 1% of the calls in 2017. So it's really a priority for us to conduct outreach to non-English speakers to make sure they understand their healthcare rights and how to access the Help Center's services. So, do we have any questions before I move on?
Yes, one just came in, Suzanne. Can the DMHR assist with patients with multiple medical issues who have been on full scope Medi-Cal, but now that they've turned 21 years of age, they're being forced to choose a plan? There's in parentheses LA Care of HealthNet, and are being told that they no longer can be on full scope Medi-Cal. Can you answer to that?
I would encourage that individual to file their complaint with us. Again, as I said earlier, if it's not something within our jurisdiction or authority, because we don't license and regulate the full scope Medi-Cal, I think that's what you said, we will direct the consumer to the right agency that can handle the issue.
Excellent. Oh, and another question just came in. Children's Hospital is about to be transitioned to an adult hospital. She doesn't say which one. My daughter has a rare syndrome, 46 inches tall, 54 pound, literally the size of a 6-year-old, never went through puberty, and is a pediatric patient. This mom says that she wants her to stay at a children's hospital. Can she be denied to stay at the children's hospital because she's so extremely medically fragile, and every hospitalization's in a PICU, in a pediatric intensive care? Did she say? She didn't say how old.
So again, I would encourage the mother to file a complaint on behalf of her child. There is something under the law called continuity of care, completion of covered services that may be applicable in this situation. And if not, the health plan has an obligation to ensure the safe transfer of child care to an appropriately qualified specialist or facility. If they are not legally entitled to completion of covered services or continuity of care. And, it's hard to answer these cases without knowing all the facts, but it's certainly something we can help navigate for that individual.
Okay.
And I will, at the end of this presentation, my information available so that people can reach out to me directly and I can help troubleshoot matters for them.
Excellent, thank you. And one last question before you move on. If a client does not speak English and would like to file a complaint, how would they best do that?
We have, we have, at the end of my presentation, I talk about that. We have the complaint form available in a variety of languages. So depending on what it is, we have all the form available in all Medi-Cal threshold languages available for download, and we also have Spanish online.
Great. Okay, thank you. That's it for now.
All right. Well, and I wanted to add while we're here, somebody asked a question when they signed up about how to get additional insurance coverage for their son with special needs. And that's not really something we do here. We would refer them to the Health Consumer Alliance, which I'm going to speak about momentarily, to assist them in locating that other insurance. We'd also suggest they contact the Department of Healthcare Services for if they're Medi-Cal, to determine if they're Medi-Cal eligible, or visit their local social services office. And again, if we can't handle it, we will do everything we can to point you in the right direction. Okay. So here is our IMR complaint form. And this is on our website at our web address, which I think is pretty easy to memorize, healthhelp.ca.gov. And the first link on our landing page is to file an online complaint. And you just look for the green box that says submit an IMR/complaint. And the IMR complaint form is a one-page form, and it can be submitted online in, as I said, English or Spanish, or you can mail or fax it, and that would be a two-page form. And anyone can help an enrollee fill out a form and speak on their behalf, but they have to fill out an authorized assistant form and upload that as an attachment with the complaint. And it's very important the enrollee sign and date both forms. And as I mentioned, a parent can always assist a minor child, sorry about that, for purposes of an IMR or complaint without the need to complete an authorized assistant form. And again, the form is available in all Medi-Cal threshold languages for download. All right, so here are some tips for completing the DMHC's Help Center's IMR complaint form. And again, if there's an immediate threat to your health, please indicate that on our form so our clinical staff can determine if the matter does in fact qualify for expedited review. If you have some writing from a doctor attesting to that fact, that would be helpful to provide as well. Submitting the online IMR complaint form is generally the quickest way to get help, and our contact center staff can assist people in filling out the form if they need help. And if there's additional documents that you want to provide to us, because it's always good to provide as much information about your issue to us, please upload those with the complaint form. Although I should add that we will seek out additional records from the health plan as needed And again, please make sure that the enrollee signs and dates both pages of the form, because that is what triggers our ability to act on their behalf. So here is the Help Center's toll-free number and our web address. And now I'm going to talk about the Health Consumer Alliance. And the DMHC contracts with the Health Consumer Alliance, or HCA for short, which is a network of legal aid societies that provide free legal health care assistance to all Californians in every county without regard to ability to pay or income. HCA is a great resource. Its advocates specialize, as I mentioned earlier, in Medicare and Medi-Cal programs, but they also serve commercial health plan enrollees. They can provide a full range of confidential legal services, including negotiating with health plans, filing grievances and requests for IMR with the DMHC, and also requesting through Department of Social Services the state fair hearing. And their services are available in all languages, and again, provided without regard to an individual's income. And we at the DMHC view the HCA as an extension of us in your county. And some names of HCA organizations that you might be familiar with are Bay Area Legal. And for the person who asked about issues with San Mateo County, there is a Legal Aid of Society of San Mateo County, and their number is 650-558-0951. In Sacramento area, we have Legal Services of Northern California, and down in Southern California, there's Neighborhood Legal Services of Los Angeles County, and there's one in San Diego as well. So consumers living in the area of the state can get individual assistance and direction to one of the network legal aid societies by calling that 188 number on this slide and providing their zip code. Any questions at this point?
Nothing new has come in, except one of the attendees, Corey, is saying yes, agrees the Health Consumer Alliance is a great resource if it's not a regional centre client. Corey also said, in just following up with the question you had about the Medi-Cal plan, Corey says there are specific circumstances where Medi-Cal beneficiaries are exempt from enrollment in a Medi-Cal managed care plan if the person is a client of a regional centre. Hold on, what did they say here? Sorry, I lost the rest of that question. It just went off my screen. I think that those are all, you've answered all the questions that have come in. Oh, one more, I'm sorry. Is the Health Consumer Alliance, is there legal aid available? I think you answered that. Oh, do you use the Health Consumer Alliance if there's no other legal aid available?
Well, you know, if the way the attorneys that we supervise here kind of look to the ACA, if there's a consumer who's really struggling to understand what's going on and they need that additional assistance, or we can't provide the assistance and it's some other agency, we will give them the contact information to reach out and retain one of the advocates at particular legal aid organization. Does that make sense?
Yes. Yeah.
And tell Corey, thank you for your insight about HCA and the exemptions involving Medi-Cal.
Yeah, Corey just finished that by saying, if the person is a client of the regional centre, hold on, my question boxes are going all over the place, I'm sorry. If the person is a client of the regional centre, they could ask for their service coordinator. Otherwise, someone from your office could reach out to Corey directly, and I'll send this information out to all the attendees on the webinar after this. After we're done, I'll just send an email out with all of Corey's information. But no other questions have come in, Suzanne.
All right. Well, hopefully I'm covering all the bases here. All right. So now I'm going to turn to some of the department's priority projects. I'm going to focus on bullet 2, which is the timely access care priority project. So the DMHC monitors provider networks and the accessibility of services to enrollees by reviewing standards for geographic proximity to enrollees, physician-patient ratios, and timely access to care. The law requires health plans to make providers available with specific geographic and time-elapsed standards. Specifically, the law says a health plan has to have a PCP with a contracted PCP within 30 minutes or 15 miles of enrollee's residence or workplace, and the same is true for contracted hospitals. Timely access law also requires health plans to ensure their network of providers, including doctors, can provide enrollees with appointments within a specific number of days or hours. And this is what this slide or fact sheet refers to, and it's available on the department's website in English and Spanish to provide healthcare consumers with an understanding of what their legal rights are to timely access to services. So, for example, an individual who has a non-urgent need to see their PCP is entitled to have that appointment scheduled under the law within 10 business days of the request. Likewise, non-urgent appointments with ancillary providers, some examples being diagnostic testing, such as a mammogram or MRI or physical therapy, have to be made within 15 business days of the request. And so if your health plan doesn't meet this standard, you have a right to submit a grievance to the plan if it's non-urgent, or if it's urgent, come directly to the health center with your complaint. So as I mentioned at the start of this presentation, engaging the community is a high priority for us. So we have other materials available to you that might be helpful to spread the word about us. Those include the Help Center brochure and business cards with our contact information, and the business cards are available in Spanish. Also, if you're interested in having someone make a presentation to your staff, like I am doing today, you can contact Mary Watanabe, who is our Director of Health Policy and Stakeholder Relations. Her contact information will be at the end of this presentation. You can also contact me as well. And you can add one of our banners to your website that you see here on this slide by contacting our media at dmhc.ca.gov. And I would also encourage you to sign up for our listserv by entering your email under Keep in Touch on our website. By doing that, you'll get our quarterly stakeholder newsletter, press releases, and notifications about stakeholder meetings. So that concludes my slideshow. If you have further questions, ask them now, or you can contact Mary or me. My email address is my first name dot my last name at dmhc.ca.gov. And I want to thank you for your time and interest, and I hope you found this presentation informative. And we here at the Health Center and the DMHC look forward to serving you and the families you work with.
Fantastic, fantastic, Suzanne. Thank you. It's really, really informative. Okay, one more question has come in. Is there anything we can do to get LA Care to expand their coverage to include UCLA Hospital and not just the clinics? Currently, LA Care is covering most pediatric PCPs and specialists, but if the patients need to have surgeries or any procedures done, LA Care is not covering those because they do not contract with the hospital, which makes it very difficult.
Well, we can't force the plans to expand their networks of contracted facilities, but we can look at individual complaints requesting to go out of the plan's network for services. And I would encourage people to bring those issues first to LA Care, and if you're not successful, come to us, and we may be able to get the plan to authorize, but it's really on a case-by-case basis.
Yeah. Thank you for that answer.
Welcome.
Okay, people are just putting in saying thank you, thank you. They've really found this really informative. So I think that brings it to a close. And I want to say thank you to all the attendees for being with us today, and Suzanne for your excellent presentation and for the amazing work that you're all doing at the department. So I just want to remind people, please answer the short survey question that you'll be getting in your email after it just really gives us valuable feedback. So that is it. Thank you again, Suzanne. Have a wonderful day, everybody. Yeah. Bye-bye.
Yeah.
Bye.
Bye-bye.